Hi everybody, and welcome to This Month in Telemedicine. It's January in 2017, and we're kicking off the new year in a great way with our new Chief Operating Officer, Sabrina Smith. Sabrina, thank you and welcome to the ATA family.
Well, thanks, John. It is an absolute pleasure to be here, and I am so excited to become part of the ATA team and looking forward to doing some great things with the organization.
Sabrina is a great find for ATA. She not only has association experience, but healthcare as well. You came from, what was the association? You came from the Regulatory Affairs?
Regulatory Affairs Professional Society, and prior to that I worked with the American Academy of Physician Assistants. But I think the part of my background, I love association work and have committed to it, but I think my work in healthcare administration has been just a blessing.
Yeah, and you've done several things in transplant, as I understand, and your background in education's in healthcare, so it's a great find for ATA. What did you do in the healthcare space?
Oh boy, John, I've been in healthcare for so long. Let me see if I can go back.
It's not a test.
But about 20 years in healthcare administration in a variety of different roles. So I was manager of the solid organ transplantation program at the University of Colorado, and was recruited to come to Washington, D.C. to run their transplant and immunogenetics laboratories at MedStar Health. And so I spent a number of years at MedStar Health, serving in a variety of capacities.
And a little touch with telemedicine along the way.
A little touch with telemedicine. In my role there, I also oversaw grants administration for the National Rehabilitation Hospital. And we had a line item appropriation in rehab medicine and had the opportunity to work with the Department of Defense on a variety of different projects. And at the time, I didn't necessarily know that it was telemedicine, but because I don't think we were calling it that back then, John.
That's all right.
But working with wound care, sports concussion, lots of different areas.
That's great. Well, as you know, our goal is not to necessarily have it called telemedicine, just call healthcare. So
you got
it's
it.
Perfect. It's a great start.
You got it.
Sabrina is going to be working with all the staff here, and our staff is expanding as well, and helping me and helping the board manage the organization as we go to the next level. We've got a lot of fun things ahead of us this year. We are just now finalizing our 5-year strategic plan, and you're going to hear a lot about that coming up in the next couple of months, and a few other projects that you've got working on right now. Is that right?
I do. Like any good COO, I'm going to jump right into assessing the organization and looking at our infrastructure. But more importantly, I think we all know that COOs work on infrastructure. I think but working with you and the leadership and the staff to really understand our members and what their needs are, and pulling together the business intelligence that we need to deliver premium and quality services.
That's
so
great.
Definitely assessing the programming as well.
Fabulous. You know, I've been saying to some folks for the last couple of months, we got a lot of changes coming forward, and one of them is really focusing a lot more on the huge resources that we have in our membership base. I think we have a great opportunity to do a lot more with our members, to have you take a step up and play a more aggressive role in terms of where the organization is going, and also to listen to a lot of what you're saying about where ATA should be, some things we should be doing, maybe some things we shouldn't be doing. But I think it's important, and you're going to hear a lot from us on that as well coming up. So it's going to be a great time. We're going to be a very busy time between now and our annual meeting. It's coming up in April. And I look forward to this, and I think we'll hear more from Sabrina in the next couple of months, a little update on how things are going.
Sounds like a plan, John.
Great. Thank you. Hi, and we're back. Thank you very much for Sabrina for being with us, and we're now here with Gary Capistrant. Gary, you seem a little bit, I don't know, stressed. I guess it must be with all the changes in the administration and all the work we got going on. I think you'll be okay, but in the meantime, let me talk a little bit about where we are with the ATA and some of the things that are happening. So I mentioned earlier with Sabrina, we have the 5-year app, or 5-year plan that you're going to hear a lot more about. But the app, speaking of the app, we have our new mobile app that's available from, you can download it for your digital phone, digital devices. It has our member directory on it, all of our discussion posts with the new interaction that we have that's going on the website. All the documents and files, our Twitter feed, the latest industry news and communications. So it's a new initiative of ATA, and I hope you have a chance to download it, certainly for all of our members. It's a way to provide us feedback, and we'll be doing a lot more in that. You'll hear a lot more about that. We have a couple of things that are on the horizon in our guidelines. We have a whole host of guidelines that ATA has. The ones that are coming up between now and the annual meeting, we have telestroke guidelines that we've been working on with a number of professional societies. I think that's very important to look forward to. And the child and adolescent mental health and pediatrics guidelines are all in their final stages of development, and you're going to see those coming out in the next couple of months. There's been about a year's work on all of them with a lot of people, a lot of our members and a lot of other societies and a lot of other people from around the country and other parts of the world has been working on all of those guidelines. So look forward to those. Here within the organization, as Sabrina mentioned, we have all new technology platforms. Anything from our computers to our membership database to our financing. Everything is brand new, and we're working on all of it being integrated, and I hope over the next year you're going to see a lot of other changes with that that's internal, but will help a lot in terms of our member communications. But of course, the biggest thing we're all working on is the annual meeting. That's coming up in April in Orlando, Florida. T2, Telehealth 2.0, the Transformation Advantage is the title of it this year. There's going to be a lot of changes with it. You're going to find a lot of relevant activities and a lot of new types of presentations. We have something we call learning pathways for attendees that will include presentations on the latest outcomes, case studies, posters, demonstrations on the floor and the exhibit floor, and relevant exhibitors, and also lists of contacts and networking in any number of critical areas for telemedicine, from working in the emergency room to working in the home care area, the whole variety of things. There's a lot booming, and our conference is really reshaping itself. Just in the next year, you're going to see a lot of changes. It's probably going to be 2 years before we completely redo our conference, but it's very exciting. I hope all of you can be there, and I think this year is going to be a lot of information. It's going to be very relevant and very helpful for everybody in telemedicine, whether you're just starting or whether you're an old pro that's been around for a long time. I look forward to seeing you there, and we'll be back, and I'll be talking to Gary Capistrant a little bit about the politics in Washington right now. Hey, and we're back again. Gary, you're looking a lot better. Congratulations.
Thank you.
You know, it just takes a little bit of time. Good to see you, Gary. How are you? Happy New Year.
Happy New Year to you.
It's a big time in Washington. It's a big week. This is inaugural week. And in honor of that, we brought in a couple of props for us, Gary. And I'd ask which one you want, but I think you better take both.
I think I will be nonpartisan and won't take either.
Oh, there you go. He is not going to take either.
How's that for being contrary?
He's left me holding the icons once again. Thanks, Gary. So now I've got an elephant and a donkey, and I don't know what to do with them, so we're going to let them go. Anyway, so we are back, and we're going to hear a little bit about the new year and what's going on. Gary?
Well, first of all, one of the things that's going to be big for 2017 is telehealth moving into the TRICARE program, the federal government's program, actually Department of Defense, covering over 9 million Medicare beneficiaries. Congress extended telehealth to that TRICARE program. The coverage will actually begin within 18 months. So hopefully it's something that will happen the coverage will begin in 2017, but it's certainly a big step forward for telehealth. And
So how many people are going to be covered?
9.4 million are in TRICARE. So importantly, it's more people that are in TRICARE than Medicare now covers for telehealth.
Wow.
So this is a big step forward.
Are they going to go through regulations for this, or they can just go ahead and start?
It's unclear. There probably are some regulatory things that they need to do, but it may be something that it's not so much regulation as administrative provisions for, you know, how do you, like Medicare has the code modifiers to tell them that it's a telehealth code. So is that going to be something that TRICARE is going to do? that wouldn't necessarily go through the regulatory process.
That's more of an administrative coding issue.
Right, right.
Okay. And this is for all DOD? And
Well, there are certain people that are in TRICARE. You know, if you're active duty military and you're going to a military hospital, you're covered directly through DOD, Department of Defense. And TRICARE is a lot of the retirees and the beneficiaries of somebody that's in military uniform.
so this comes on top of a couple of years ago, actually last year, when they implemented the change for DOD on DOD physicians being able to have one license across all states, but that's for the DOD side. That's not for the TRICARE?
Well, I think that's to be resolved. The issue
Okay.
specifically, as part of the legislation, was to extend that policy to TRICARE. Congress didn't do that because of opposition from the medical establishment. And so I think it's to be worked out to what extent does that overall DOD policy cover TRICARE. So important development there moving forward. That certainly gives more impetus to Medicare moving forward. Medicare's been the lagger on the federal side. Some progress there. We do have 8 new codes, procedure codes that are covered for beginning in 2017. 2 of them, the most significant on critical care, 2 codes there, 4 for end-stage renal disease services from the home, and 2 dealing with end-of-life advanced care planning. There's some other procedural things. The place of service is now to be coded 02. There is a reimbursement change that will result in lower payments for telehealth, dealing with practice expense, and then the code modifier, which has been GT. The CPT people over at the American Medical Association have done away with that code modifier, and it's now 95. So big change from GT to 95.
GT to 95, wow.
That's right. An important development is that every year we submit a code request to CMS. We submitted a request the end of December that for consideration in 2017 for possible additions for 2018. Importantly, what we did is suggest that after Medicare has been dealing with telehealth for over 15 years, that there's ample evidence to allow them to greatly open up the list of procedures that get covered. And as other payers move toward complete parity for telehealth, that the Medicare program ought to as well. So specifically, we encourage them to cover services that are consistent with professional judgment, with standards of care, and then picked up some language that is in another part of their telehealth provisions that to include services unless they are not safe, effective, or medically beneficial when performed as a telehealth service. So we'll see what happens to that. It could be an opportunity for Medicare to kind of get unstuck from this very restrictive code by code analysis that they've gone through. We also encourage coverage of physical medicine codes when covered by the current physicians and practitioners, coverage of some further end-stage renal disease issues. This has to deal with Medicare still requires in-person exam of the catheter access site monthly, and that's a barrier to home dialysis. And then for Medicare to cover online evaluation and management services. So importantly, for 2017, our federal priorities are going to be on Medicare. We will have, it's a new Congress, so the bills begin all anew, have to be reintroduced, and importantly, when those bills come out, you can play an important role as urging your members of Congress to co-sponsor the particular pieces of legislation. Been talking with the various people who have been authors of the major bills, and they're all preparing their bills for reintroduction soon, and we will be following up with information on the website about those major bills as they come out. For Medicare even more specifically, our priorities are going to be to get telehealth into Medicare Advantage, into accountable care organizations, the coverage of stroke for all beneficiaries for remote stroke diagnosis, and then further coverage for home dialysis patients. We will also be pursuing the one state licensure model. We talked about it being considered for TRICARE. It was also up for Department of Veterans Affairs, and I expect that those will be important issues in 2017.
So before I know you want to talk about states as well, but so we have to turn to what's going on in this town this week. We seem to kind of not mention that. There is a new administration, a significant changeover in all of the top levels, certainly, and a major change in the thrust of policy. We could be seeing the death of the Accountable Care Act, or at least certainly changes in it, and major changes in other areas as well that affect telemedicine, anything from Food and Drug, the Federal Communications Commission, Federal Trade Commission, and obviously in HHS and in Medicare. So here's the question for you. What does all this mean, Gary? Help us out.
Well, it means a lot of change. I think it's all going to be good for telehealth. It's the kind of change that moves toward telehealth and creates the opportunities for telehealth. There's a lot more focus on cost containment, and so that telehealth can benefit from that. A lot more emphasis on various managed care arrangements like Medicare Advantage and Medicaid managed care and other kinds of things that then those providers will be able to have more flexibility in moving forward. A lot of what will go is that kind of federal micromanagement about the kinds of things that are in Medicare statute and other provisions to keep telehealth separate and controlled, and those kinds of things will go away.
So the movement that we've seen in the last few years away from fee-for-service toward managed care, capitated care, quality-based, that's going to continue or maybe even accelerate?
I would say it will accelerate when it's for a group of people for all of their care, like the accountable care organizations, Medicare Advantage. It's possible that some of the efforts, like with bundled payments for certain procedures or all of the MACRA provisions, that those could get blown away by such things as premium support for the Medicare program. So I think some of it is that there's potential for a lot of change, but also things have kind of gone silent in recent weeks about exactly what could happen to how they're going to deal with replacing Obamacare, what they're going to do about Medicare, what they're going to do about Medicaid, what they're going to even do about the Department of Veterans Affairs.
Yeah.
And so obviously we're watching that closely. We're trying to nudge it in certain ways, but some of it is we haven't heard from the major people, whether it's the incoming president, Congressman Tom Price, who's his nominee to be Secretary of HHS, the woman that's been nominated to be head of CMS, or even from the congressional people that may play a more significant role in the kind of more detailed aspects of policy like telehealth. They've kind of been pretty silent about Medicaid block grants, Medicare premium support, some of the other kinds of issues. So,
but we have been in contact with some of the transition team and certainly communicating the ATA point of view, and it looks like, and I don't want to jump too far out ahead because you're right, in that kind of a dark period where you don't have any communications coming out on what's going to happen, but certainly there's been a lot of rumors of delegating more to the states.
Right.
And as all of you know who've been watching this, there's been a huge amount of innovation that's going on, and I'm sure you'll talk about that in just a minute. And it does seem like there's been a lot of change in a lot of other areas. Congressman Price is a longtime supporter of the American Medical Association, so I think we're going to see that.
He is a doctor.
Increase. He's a doctor as well as a member of AMA.
Dr. Price.
Dr. Price. The second doctor we've ever had, right? And the head of AMA, I think.
Well,
Louis Sullivan. And
yeah, I guess I can't recall any other medical doctor.
But it's been a while. But at any
Yes.
rate, so a lot of changes, and I think we'll probably devote this month in telemedicine specifically about what we know at that point. But in the meantime, states. What's going on there?
Yes, a lot going on in states. The states have been an important level for dealing with telehealth legislation, and that continues. And as John's indicated, the states will play a much bigger role. For example, in Obamacare, or their replacement for Obamacare, a lot of that could be state-driven. The state's essentially given some money and some authority to go out and do bigger things. So our priorities at the state level for 2017 are going to be a lot of the parity coverage, continued push for parity for private insurance, and importantly there are bills already in New Jersey and North Dakota that are making progress, and in 2016 we had Alaska and Rhode Island move forward with parity bills. But parity is a concept that can apply to all payers, so for Medicaid, for state employee benefits, for workers' comp, it's all important to move forward on that. Another priority will be the state licensure compacts, the multi-state licensure compacts, for physicians, nurses, physical therapists, and psychologists that all have multi-state compacts out there to get additional states to end up joining that. And a third priority will be to get states to adopt the network adequacy provisions that the insurance commissioners have come up with. We do have a monthly state call about the specific state legislation that allows members an opportunity to ask questions, to provide further information in addition to what's available on our website. And the next one of those will be on Thursday, January 26th. You check the source for registration for it, and please tune in. It's very useful information, and it's a good place for your involvement as ATA members in making things happen in your state that then gets translated to further action at the federal level.
Great. Well, thank you, Gary. Fair amount going on, and you got your tux rented for the inaugural balls?
I'm polishing my shoes.
Oh, are you?
Yes.
Oh, great. Yeah, that's a good job. Glad you are. We're all going to be going there, I'm sure, as a group. I'll see you somewhere on the stage. I'm sure of that. So anyway, thank you, Gary. And that's it for this month in telemedicine. Thank you very much. Don't forget to be in contact with ATA if you have any questions or anything you want to know about. Go onto our website. And I will see you, and Gary will probably both see you next month on This Month in Telemedicine.